Thank you, Mr. Chairman, and I want to thank you for including my bill, H.R. 1343, the Establishing Equity in Hospital Readmission Program that Mr. Rangel's asking about now. I want to talk a little bit about it, then ask a question. The Hospital Readmissions Program was created under ACA due to concerns that too few resources were being spent on reducing acute care hospital readmissions. This program penalizes hospitals based on the last 3 years of available readmission data compared to the national average. While we do want to make sure hospitals are reducing acute care readmissions, which I think is Mr. Rangel's concern, we also want to make sure we are not disproportionately penalizing those who see a large number of our most vulnerable patient populations who tend to have a higher rate of readmissions due to no fault of the hospital. I've heard from many hospitals in Ohio, and especially many teaching hospitals, who see a large number of dual-eligible beneficiaries, low-income seniors, or young people with disabilities who are eligible for both Medicare and Medicaid who would have been unintentionally hurt under the current program. To address these concerns, I introduced the bill, which now has 82 bipartisan co-sponsors, and I want to thank the chairman for moving this legislation. This legislation provides for improved consideration of socio-economic status in the Hospital Readmission Reduction Program to prevent penalizing hospitals that serve low-income patients without masking socio-economic disparities. Adjusting the penalty to account for certain disparities in patient population can make a big difference to hospitals across the country and the 9 million dual-eligible beneficiaries that rely on these hospitals for their critical care needs.